Hi, good day, everyone. I am Edwin Jay Bolando, and I will be the first reporter.
And I am Keith Benedict P. Fernandez, and I will be the second reporter.
And on today's chapter, we will get onto personality assessment methods. So I think you know by now what personality is and why we need to understand it. And now we are going through methods of actually assessing it. So in the book, this is chapter 12, and I strongly advise that you read the entire chapter. So, we are going to cover the following. First, we're going to cover the objective measures of personality as well as projective measures of personality. So, things like the Rorschach ink blend test. And there is actually a quite wide range of tests you can use. And some are still widely used today, such as the TAT or Thematic Apperception test and hand tests, as well as Rosenweg picture frustration test. And we're also going to cover the assumptions and criticisms of projective measures.
And for the second part of the discussion, I will be talking about the behavioral methods of assessment, covering the reasons why we conduct behavioral assessment and the reactivity or and non-reactivity measures. So, and then we will also cover, as what I have mentioned, the reactivity. So, we already heard or might have heard about the Hawthorne effect, and it is when you are being observed, you know that you are being observed, and then you often alter your behavior. And the last part of my discussion, it will be the recall of the personality disorders that we have discussed or that we have encountered in our abnormal psychology subject.
Okay, thank you, Keith. Okay, let's start with objective methods of personality assessment. So, most objective measures for personality are a series of selected response format items administered by paper and pencil and most recently online, often endorsing agreement or disagreement with a statement. Sometimes uses a true false format as well, such as the MMPI. And unlike an achievement test where there is a correct answer, there is really no right answer to a personality test as long as you're giving a true response. And a true response is deemed to be indicative of a particular trait. And if you collect enough items, then you can build up an impressions of someone's psychological makeup. So how objective are objective measures? So the term objective in relation to personality must be considered cautiously. Personality do not contain one correct answer, so we can't be sure if the participant has read, understood, or answered truthfully. So the advantage is that they are quickly and easily scored. Once you put your survey app, you don't need to sit there as the person fills out the survey. They can complete it on their own time at any location, and that saves you a lot of time as a researcher. And there is no human judgment going on there. So it's just a matter of scoring. Well, the disadvantage is that it issues with insight and limitations of self-report method. So there may be a lack of objectivity here for some clients. So now let's talk about projective measures. So projective hypothesis, it suggests that an individual supplies structure to some ambiguous stimuli that we represent, and they do that in a manner that's consistent with their own unique personality, their conscious and unconscious needs, fears, desires, impulses, conflicts, and ways of perceiving and responding. In other words, it's all about their unconscious or implicit desires or traits. And this might differ from a self report measure because they might reveal something about themselves that they wouldn't admit to you or maybe even to themselves. So basically, I'll give you an example of how it works. So, have you ever looked at the clouds or daydreamed or interpreted what shapes they make? Something that we do as a kid. So, they're just random shapes. Most of the time, you're just looking at random shapes, but you're projecting some meaning onto them. This one, like this one. What's that reminds you? For me, I see a bit of an elephant. There's his head, an ear, and that is his long trunk. Let's try another one. Anyone see a pattern in that? It's probably a rabbit. There's his ears in his head and its body. But really, these are all just clouds, which don't have any inherent meaning. The only meaning that they have is something that you project onto them. See? Just clouds. It doesn't necessarily mean that you have a dirty mind. Okay, projective techniques are said to be indirect methods of personality assessment by providing ambiguous stimuli. Respondent projects their thoughts and feelings onto it, not being asked directly to disclose information about their behavior, their private life, or their personality. So, presumably, hopefully, projective techniques or measures are more truthful than anything else. So it has been claimed, particularly by the psychoanalysis crown, that projective testing it taps the unconscious mind, and we often use this idea of a metaphor of an iceberg, such as here. There's your top bit that self-report respond to, but there is much deeper element, the unconscious mind, that things like projective tests will be tapping into. So Frank said he claimed that the most important things about an individual are what he cannot or will not say, which is the unconscious mind. So now Rorschach decided to advance his field and provide a standardized test. For him, it was that we needed to have some scientific vigor or scientific effort in how we interpret them. We don't just make stuff up on the fly. We have a scoring manual. This is what is typically seen. This is what is rarely seen. So you could sort of work out how to interpret the responses. So he published the monograph Psychodiagnostics. It was set to really take on the psychological field, and then he went up and died. So unfortunately, he never got to live to see his work being widely used. But it consisted of 10 symmetrical inkblots printed on separate cards, half of which are colored and the other half is black and white. So he offered case studies of responses from normal, healthy people. So that is the non-clinical, and then from psychiatric case psychiatric cases to illustrate how they differed. And there's a special name that we called empirical criterion king, that it differentiates between a healthy group and a psychiatric group. Okay. Inkblot cards are initially presented in order from 1 to 10, so it is standardized. Everyone gets the same order, and the test takers are asked to interpret the inkblot and are provided a great deal of freedom. So we sort of encourage that creativity. The more they are being creative and inhibited, the less likely they are to suppress a response that you know might be socially undesirable. So, posthumously, a more refined scoring system was published with greater scoring accuracy. So, here are some of the stimuli. And what do you see? Well, the one on the bottom left, often people see lungs, two lungs and the spinal column. One on the top right, sometimes people see some clowns having or doing a high five. But whatever you read into it and you tell the therapist about, presumably that gives you some insight into your personality. So this one here, for example, this one is a really common example that they show to students that because that looks like a bell and this is two angels, but also it looks like an eye or a mouth, some sort of a devil mask. And if you're more fixated on the devil mask or the demon, on maybe you're part of the psychiatric group and not the one that just sees innocuous images. Okay. After the entire set of England has been administered, an inquiry is conducted and the assessor attempts to determine what features of the England played a role in formulating the test taker's percept or perception of an image's theme. So we don't just say, "Ooh, this looks like a bird with some wings." Therapists will ask, "Why do you see that? What in particularly what in particular are you noticing there?" And then you so elaborate your answer, and that gives me more to score on. So, prompts include what made it look like whatever. Whatever is what the patient says. And how do you see whatever was reported seen? And these are standardized prompts. And the aim is to clarify what was seen so that it isn't misinterpreted by the tester. When used carefully, can be a starting point for further conversation and inquiry. So, for example, if I saw a lot of demons and angels or mystical creatures, and you've got a recurring theme there, and you might want to ask as well what is your religious background? Like, do you think about religious issues a lot? And in this very small percentage of psychiatric cases, they tend to sort of obsess on religious icons and themes or scriptures, and that can be indicative of it. A whole range of condition, but it would be something you could follow up on, and you'll be able to learn something about your patient that you didn't know going on. But of course, the Rorschach is controversial. Jensen, who was a cognitive psychologist but a very respected man, claimed that the rate of scientific progress in clinical psychology might well be measured by the speed and thoroughness with which it gives over the Rorschach. So that's kind of harsh, but luckily Rorschach wasn't alive to read that. Okay, let's have a look at some other tests that use that methodology, but with a more rigorous scoring system and different types of projective images. So a more common practice used at the time was to present a picture stimuli to subjects. So you just have to tell them a little story. So that works really great with children. Children loves telling stories, and presumably the themes and issues that I bring up from that picture reflects my worldview, my acculturation, and also the feelings and thoughts that I have going on. So let's have a look at the picture for a moment. What do you see? Well, here someone is on the telephone. She looks very intently at him, and he looks very intently at her. So, are they happy expressions? Are they worried? Are they angry? That might tell me just a little bit about how you are thinking and feeling. So let's have a look at this example. I think we should start seeing other people. That is not a good sign. Maybe the relationship is in the breakdown, or maybe I'm non-monogamous. Maybe that gives you some insight about the personality or the feelings about the patient. What about this one coming from the telephone? Stay on the line. We have officers on the way. So I'm thinking more sort of a violent imagery, conflict, or anger. And from that picture, I hope you made your own story. You can see how, it rolls on or process and across a lot of images, there is a recurring theme that's something you want to pick up on. So, one of the earliest studies before Rorschach and Frank investigated gender differences in imagination. Britain 1907 found that girls reported more religious and moral themes in picture cards than boys. And in 1932, Swartz developed the social situation picture test for juvenile delinquents. This is really dated stimuli, so you'll pick up in a moment, like this one. There's a boy with this one with a very misshapen hair, and that does not look normal, writing, "I am a bad boy," while looking out the window. So, presumably, a delinquent or a teenager would identify with this. I might open up because of the picture. So that is the hope of all therapists, and I don't think it really worked too well. And here is another one. He's going out, he looks upset or angry, but he could also just looks busy and just rushing So it depends on what responses you give or the patient's responses that will give you some insight. Okay. Christiana Morgan and Henry Moray, 1935, published the Thematic Apperception Test, or the TAT. Now we're starting to get some sort of scientific vigor, and you can see here, Christiana, she was one of the early thermal psychologists. There was a time when it was almost exclusively male in psychology, and so Morgan was one of those sort of trendsetters who broke open new ground. The thematic apperception test is still used today. So it consists of 30 picture cards containing a variety of scenes that present the test taker with certain classical human situations, like situations or everyday situations that we can all identify with. And then there's this additional card present, which is blank. And when we show that one, it gives you the opportunity to project onto it or project into it your thoughts and feelings. So, cover story is that it is a test of imagination and totally not a sneaky way to spy on the unconscious minds. When in reality, the administering clinician purposefully selects the card that are believed to elicit responses pertinent to the objective of testing. So, for example, if the therapists want to know if you're depressed, they will show you a sad one. The therapist would want to know if you're anxious, they will show you that's going to provoke anxiety, even though you might not have led on to depression or anxiety. But if the therapists have suspicions, then there's the cards that they will show. Okay, so the goal again is the starting point for conversation. Uh, It's a source of, or the goal is to trace the source or origin of those thoughts and feelings. So now there's a picture on the right from the TAC. This is an example of a thematic apperception test. And material use includes the stories as they were told by the examinee. So we make not a mental note of it, or perhaps in a modern age or in our age, we would do a recording. And the clinician's notes about the way or the manner in which the examinee responded. Also includes extra test behavior. Are they cooperative? Are they hostile? Do they treat the therapy as a joke or the test as a joke? It gives us an insight into how they are thinking and feeling. And if it's an online test, you don't get that extra test behavior. So it's really useful to observe their body language as well as tone of voice. Okay. There's an example responses to our telephone conversation card given on page 414 of the book. So might as well have a look at it. For example, a male respondent. This guy's been involved with this girl for a few months. Things haven't been going all that well. He suspected that she's been seeing a lot of guys, so he got jealousy here. So this is just one scene in a whole evening where the phone just hasn't stopped ringing. Pretty soon he's just gonna get up and leave. So this one he's frustrated. He doesn't like his partner talking to other people, even girlfriends or even friends, and suspects infidelity without necessarily there being any evidence. And the female response, the couple is dating. They haven't made any plans for the evening and they are wondering what they should do. She is calling up another couple to see if they want to get together. That would go out with the other couple and have a good time. So in this response, there's no depression, no paranoia. They're nice, healthy response, and they've got some other ones here that I won't go through all of them. I'll just leave you for you to read that. Okay. Let's go through some of the criticisms of the TAT, like Rorschach, the validity of the TAT is dubious, with a meta-analysis by Spangler finding little correlations between TAT evaluations and self-reported personality. Now, what would be a projective psychologist say? Well, of course, there's none. These are their unconscious thoughts and feelings. They are not going to admit it to you, so we shouldn't expect a high correlation. So that's a criticism, but it's also more like a defense. So we need a little more. But it might just be revealing things that they wouldn't admit to. So other researchers claim it measures implicit motives that are thoughts or issues on their mind. So rather than revealing aspect of personality, maybe it just identify issues and themes that are going on in our lives or their lives, and that can be clinically useful in itself. So there's a lack of standardization and administration scoring and interpretation procedures. Note that the collection selects which cards they want to elicit the response, whereas the Rorschach, he went all through them in sequence. The top cards themselves, as you saw with that old lady looking over the shoulder, they're gloomy and bleak, and so it might restrict the range of effect or feelings projected by the test taker. So perhaps it could be improved by adding some happy and neutral ones. So highly susceptible to faking, particularly faking like the Rorschach, especially in high intelligence subjects. So if you murder your partner and you want to get off in a psychiatric defense, and you can find a psychiatrist that is using it or using the TAT, you can probably play crazy pretty well. That's why we have other tests like the MMPI to really try to control for that. While it might not tap deep personality traits, it has been argued that it might be a better indicator of psychological states. So, some other tests that use pictures as projective stimuli, we've got the hand test by Edwin Wagner. And the hand, this is an interesting one. It shows a series of consists of 9 cards. So I don't actually make the hand gestures, but it shows the pictures of hands on them. And the tenth, like the that is a blank card, and you can feel that in yourself. So test taker is asked to imagine what the hands on each other might be doing. So I guess some of these are very suggestive, others are very generic. Now the problem is that there is some cross-cultural variability on hand signals. Facial expressions are universal, but unfortunately hand signals mean different things. So in the US, thumbs up means good or okay. But in Iran or Iraq and Afghanistan, it is reported to mean or essentially mean up yours. So up yours is a rude gesture. So we need to take that into consideration. Remember, when you're doing a test, you have to consider the cultural background. And we actually do a really detailed analysis. So this one here, for example, or that one here, we break it down into these 4 categories. The interpersonal responses, second is the environmental responses, third is maladaptive responses, and the fourth one is withdrawal. Now, Wagner came out with a ratio called the acting out ratio, using the hand test score to provide an indication of how likely each subject was to act out violently. For example, this here, like this one. For a violent person, I'm about to slap someone across the face. Sometimes it's very hard to make a story out of a hand drawing. So, like this one. So, as you can't see the rest, because you can't see the rest of the body. And so, some people really struggle with this test. It's just, they can't work out what the feelings or emotions are for the person who's holding up the hand because it's only the hand. And then there's this Rosenweg picture frustration study. It's really interesting one. It employs some cartoons depicting frustrating situations. Okay. So it employs a cartoons depicting frustrating situation. Test taker is asked to fill in the response of the cartoon figure being frustrated. So this guy here, and whatever they write, that's we analyze. So it says that it's a shame my car had to break down and you had to miss your train. Now, if I said it's a shame, I'm worried if the police come up and they open or inspect your car, they're gonna see the dead body. Well, obviously, that will indicate that I am a violent person or I'm thinking about violent things. If I said no, it's not a big deal. We'll make it to the next train. It won't be a problem. So it's more relaxed and there's nothing to worry about. So some people will really really get frustrated and others will be more laid back and that's some useful information. This one here, almost like you wanted me to miss it. So it's sort of like a passive aggressive that would be really interesting to know. So cards are available for children, adolescent, and adult samples. So obviously you wouldn't give this to a child because they're adults. They wouldn't be out or identify with them, the pictures. So responses are scored in terms of the type of reaction elicited and the direction of the aggression expressed. So do I turn it inwards towards me? Like, I'm so silly, I should have left earlier, it's all my fault. Or do they turn it out with like this one here? Like this one here. But they're doing it like a passive aggressive way. So extra punitive. That is it outwardly express. And there's this impunitive. So when I said before, as I said before, no big deal, we'll catch the next one. I'm like sorting out or avoiding the frustration and avoiding expressing it. So word association test, it involves the presentation of a list of stimulus words. So first proposed by Galton, but he wanted to do it as a cognitive measure. So of your intelligence. So, how verbally expressive are you? In fact, we still use those type of verbal fluency tests in cognitive studies now. So, if you're asked to respond verbally with the first word that comes to mind, no matter what it is, as now I'm going to toss you some softball questions initially to lull you into a false sense of security and then gonna hit you with something to try and tap your unconscious mind. So it was widely used and associated with psychoanalysis advanced by Carl Jung and as a way to tap the unconscious mind. So report 1945 extended these techniques, developing a standardized test of 60 stimulus words. Some are classified as neutral, such as chair, book, taxi. And that gets you lulled into a false sense of security. You start to build up a rhythm and you're just blurting out whatever pops into your head. And then we have the dramatic ones like love, girlfriend or boyfriend, mother, father, suicide, fire, and breast. For some people, if they had a conflict with father, they might say angry or and that might tell me a little bit about their life. Of course, the psychoanalysis people took it too far, probably with the so-called Electra complex and Oedipus complex with the father and the mother. But a word like fire or suicide, if they said so that the word suicide, they would said peace, that told me something really important about what's going on their mind. So again, this can be used as a sort of icebreaker to tap out the or to tap the unconscious mind. So the thing that's different here is that they provided normative data to show the percentage. So the percentage of occurrence of certain words. For example, for stomach, 21% replied with ache and 13% ulcer. Of course, you will not associate another word from stomach to a unicorn. So you know what words are typical and what words are atypical. And if you get one of these typical ones, you know that you're paying attention to it. So sentence completion test, it involves presentations of a list of words that begins a sentence but are incomplete. So assessing task is to respond by finishing each sentence with whatever words comes to mind. So you can do this verbally, but it's often better done in paper and pencil so that they can actually fill it out themselves. Such as this: I like to start fires. S- Someday I will conquer the world. I can now start and see a pattern here, and there might be some issues. Let's go to the third one. I will always remember the time back from the bus stop when I. So this reveals something about the person. So it may be relatively a theoretical, or it may be linked to some theory. So you might use psychoanalytic theory with this, or you might use cognitive theory. Maybe this represents a type of cognitive schema raised by that person, and it gives you some sort of insight. Maybe relatively theoretical or linked closely to some theory, as I've said kanina. So sentence completion stems may be developed for use in specific settings or for specific purposes. For example, examining family, social, and or sexual attitudes. These are all good topics to delve into with a client eventually, but sometimes they are reluctant to talk about it. So that is the purpose of the sentence completion task. It's kind of giving them almost a permission to talk about it. And you can tailor the test towards and themes towards the things that you want to ask about. And then there's this figure drawing test. Now you might think on drawing us for kids lang, but you'll be surprised of how many adults actually draw. So many people, adults, engage in coloring. So there are coloring books for adults. So art is one way, and we often use art therapy even to express yourself. And there's two reasons why this is good. One reason is for diagnostics. The second reason is we know that if you express yourself, you get things off your chest, even if you don't do anything about them. The mere act of expressing it, like writing a diary or etc., that can be useful clinically because it lowers your anxieties. Okay, so the figure drawing tests, the assessee draws are drawing that is based on the content of a particular topic. So I might say, draw a picture of you and your family. And then if the mother and father are there and they're happy, smiling, it might be different from one of them missing, or they both scowling or angry, or maybe they're shouting at each other. That might give you some insight into the child's life. So, drawings provide a wealth of information, especially about issues that are difficult or traumatic to express verbally. Ideally suited to young children, but can be used with adolescents and even adults. So, there was a test for the draw a person test. So, images are evaluated, and we evaluate characteristics of the drawing and then infer something about their personality. We evaluate the length of time required to complete the picture. So are they a perfectionist? They will take it as a 20-minute drawing, or is it just a quick scroll? We evaluate things like the placement of the figure. So the two figures next to each other or very far apart, and we're also going to evaluate the size of the figure, pencil pressure, use symmetry, line quality, shading, facial expressions. Actually, it is quite important. And it is important also to look at their posture of clothing and overall appearance of their drawing. Okay. Clinicians will also ask follow-up questions about the drawn images, like, tell me about that boy or girl or man or lady. Responses are related to hypotheses and interpretations about personality functioning. So I'm going to show you, I had some reluctance to include this, but it is in the book and you would have seen it anyway. The picture on the left here is drawn by an adult male. He is a rapist, and he draw big, burly, strong dominance. That's the way that he sees himself. Now, most people are just going to draw a stick figure, or if you're going to be artistic, they probably wouldn't draw themselves like this, like there's no shirt. And that tells me something about the person, or that tells you something about the person. Now, the one right here is even sadder. Now, pedophilia is a terrible crime, but we know that often abused children, if they don't receive intervention and therapy, a lot of them aren't even identified sometimes. Not always, but sometimes they become abusers themselves. So you might see a client and you might get the referral as a male pedophile, but this suggests that he is a very childlike perception of himself, probably what Freud would or Erikson would call the arrested development. Developmentally, he did not progress beyond a chance. Something actually really bad happened to his life. So hopefully it illustrates the usefulness of the draw a person test, but also there's tinge of sadness there with some of the clients that you might encounter. Okay, another one for children is the kinetic family drawing. Child draws a picture of his or her entire family, including themselves, doing something. Helps learn about the examinee in relation to his or her family. Even non-clinical applications to top attitudes and beliefs. Draw a sentence test examines gender stereotypes about STEM, or science, technology, engineering, and math. Almost exclusively, that is what they get: a white male scientist. A recent 2007 study found only 14% of girls draw a female scientist. 86% of girls draw a male. So that will give you some insight onto suicidal attitude towards science. Sorry. So right now there's more about projective methods. It's under page 425 to 428. We've got some assumptions underpinning them. They would be fair game to assess, as well as criticisms of the projective test. So criticisms or projective stimulus is only one aspect of the total stimuli situations. There's other things going on. The stimuli material may be so ambiguous that you can't interpret it, or it may be so untransparent that they know what you're asking. So it shows someone arguing or a really sad scene. There's no longer ambiguous, and we can't really project onto it. We're just reporting what we're seeing. And some assumptions are our cherished beliefs, these ones over here, assumptions, that less subject to faking, but the evidence behind that is contestant. So there's more pros and cons there. So please do have a look at that. So I want to go through some further assumptions that every response provides meaning for personality analysis, that a relationship exists between the strength of a need or a desire or feeling. These unconscious things, and it's a manifestation on this projective instrument. Now, maybe that the type of stimuli that you're giving them might be leading them towards one set, like the TAT or the thematic analysis test, that was rather gloomy and doesn't lead them towards to more positive or optimistic desires. So test takers are completely unaware of what they're disclosing about themselves. That is an assumption. Now, in high intelligence individuals, there will be like clients who will be faking it. The Rorschach implant test is publicly available. Someone like dumped into interwebs about 5 years ago, so you can actually practice your responses. Like you can write down a really elaborate story and coach yourself with the Rorschach, so that is an issue. So a projective testing protocol reflects sufficient data concerning personality functioning to formulate a judgment. And I would argue that you should supplement with other tests and other sources of information. So You can still use them, but don't make it like a sole criteria for judgment only. So it also assumes that there is a parallel between behavior obtained on projective instrument and behavior displayed in social situations. In other words, this test is actually measuring how you would behave. Sometimes people will try to shock the therapist by giving bizarre or unusual answers. So you don't always reflect how you are actually thinking and feeling. So that ends my report. Keith, are you there?
So now, since the projective assessment method is already discussed by Mr. Blando, so let's proceed with the behavioral assessment methods in assessing personality. Behavioral assessment method together with projective method are the new materials or method in assessing personality prior to the widely used or widely used traditional assessment method that was used by many psychologists. So traits, states, motives, needs, drives, defenses, and related psychological constructs have no tangible existence. That is why the behavioral assessment method came to exist, because this construct, wa- this construct whose existed must be inferred from behavior. So this construct, which is not tangible, there's no tangible existence, is inferred only through behavior. So that's why behavioral assessment method is emerged. So traditionally, clinical assessment are conducted using tests and other tools to gather data and this method is labeled as signed approach. It's because the test responses are believed to be signs or clues only of underlying personality or abilities. And in contrast, alternative philosophy of assessment, which is referred to as the behavioral assessment, is labeled as sample because this approach focus on the behavior itself. Now, behavioral assessment is important tool for clinicians specifically because it gives um, given the issues of self-report and questionable validity of some projective methods, because not all projective methods have validity issues. So behavioral assessment is critical because we cannot conduct clinical assessment in clinical setting without considering the behavior of the client. And ultimately, we study personality because we want to be able to predict future behavior and understand motives. And according to Michelle 1968, that the emphasis of behavioral assessment is on what a person does in situation rather than on inferences about what attributes has more globally. So she believed that the behavioral assessment focuses more on what the person is doing in a situation, his environment, his interaction with the environment. That is the emphasis of behavioral assessment method rather than the inferences of that person. And it is certainly science based in that it relies on relatively precise method of proven validity. So difference between traditional and behavioral approach to assessment exists with respect to several variables. So first is the use of the difference in the use of the data, the causes of behavior, the approaches, and the role of history. So the difference between the traditional and the behavioral assessment in respect to the use of data is that in traditional approach to assessment, data is typically used to diagnose and classify, while behavioral approach, uh, the assessment data is used to describe targeted behaviors and maintaining conditions. And in respect to the cause of behavior, the traditional assessment is more likely to evaluate the traits and states of an individual, collectively refers to personality as the cause of the behavior, while the behavioral um, assessment is more likely to focus on attention on the conditions of in the environment that were instrument in establishing a targeted behavior, as well as the environmental conditions that are currently maintaining the behavior. And in the approaches, the behavior approaches to assessment focus on the meaning of the behavior itself rather than making inferences about personality from samples of behavior. So this is in reference to what Michelle stated earlier. And the last is the role of history. So in traditional approach, they believe that history plays an important role in assessing personality because they believe that the history is the is a predetermining factor in the future personality or behavior of a person. While in while in behavioral assessment, behavioral approach, they did not put a greater emphasis or greater importance to the role of history because I only except that if the assessment really needs a retrospective baseline. So these two approaches are way different from each other. It is very evident in the differences that I have discussed, but many psychologists prefer to use the behavioral assessment method. So now let's proceed to the who, where, what, why, when, and how of behavioral assessment method. So first one, the who of behavioral assessment. First is who is the assessee. So typically the person being assessed may be, for example, a patient on a closed psychiatric ward, a client seeing seeking help for at a counseling center, or a subject in an academic environment. And who is the assessor? So depending on the circumstances, the assessor may be a highly qualified professional or a technician or assistant trained to conduct a particular assessment. So with regards to who is going to do the observation, so it is up to the assessee on whether he himself will administer the observation or he will appoint somebody to observe the situation, or the parents, maybe the sibling, or anyone that he wanted to appoint. Second is the what of behavioral assessment. What is the question is what is measured in behavioral assessment? So perhaps not surprisingly, very and not surprisingly, the behavior or the behavior targeted for assessment. So what is measured in behavioral assessment is the behavior itself, and it will vary as a function of the objectives of the assessment. So what contributes to a targeted behavior will typically be described in sufficient detail prior to any assessment. So for the purpose of assessment, the targeted behavior must be measurable, that is quantifiable in some way. So the when of the behavioral assessment. When is an assessment of behavior made? So one response to this question is that assessment of behavior is typically made at times when problem behavior is most likely to elicit. So the first answer to this question is that the behavioral assessment is administered or conducted when the behavioral problem elicit, or at the time that the behavior is occur. Then another way to address the when question has to do with the various schedules with which behavioral assessment may be made. So um, first is the frequency or event recording, and the second is the interval recording. So one of the scheduled assessment is the frequency or event recording, in which the assessment is recorded every time the behavior occur. And the other another type of scheduled assessment is the interval recording. In this type, a predefined interval is set, and say for example that an assessment will be conducted twice a week, once a month, and thrice a week or twice a day. So that is the interval recording. And in those methods, the observed behavior are basically tallied. However, assessors does not only tally recurring behavior, but also the intensity of the behavior, and the intensity is gauged according to the duration of the behavior. So one method in measuring the frequency and intensity is through timeline follow-back methodology, or TLFB methodology, in which is originally designed for use in the context of a clinical interview for the purpose of assessing alcohol abuse. So it is originally developed to assess the alcohol abuse of a person, and particularly in identifying antecedent stimuli that cue the undesired behavior. So in TLFD methodology, the client is given calendar from which they are going to recall aspect of their drinking habit or drinking action. So to avoid the to aid the recalling, the clients are presented important events, for example, a birthday, an anniversary, or any important event that the clients can easily recall. And say for example birthdays. So the assessee will ask how many bottles of drinks the did the did the client drinks. So in that way, the clients will be aided thoroughly on how many and how on the intensity of his drinking habit. And from this information, derive the assessment of the patterns of the targeted behavior emerge, and if ever the client is abusive or not. And by the way, in TLFB methodology, in not only the alcohol abuse is measured, but also the gambling and smoking and etc. The next method of measuring the frequency of and intensity is the ecological momentary assessment. It is a methodology was this methodology was used to analyze the immediate antecedent of cigarette smoking. So specifically, the ecological momentary assessment measures the antecedents of cigarette smoking. So moving on, the where of behavioral assessment method. So where does the assessment takes place? So in contrast to the administration of psychological tests, behavioral assessment may take place just anywhere, preferably in the environment where the targeted behavior is most likely to occur. So it is one of the advantage of behavioral assessment, because the assessment can happen in anywhere. So next is the whys of the behavioral assessment. So why conduct behavioral assessment? So often we use behavioral assessment because it often provides a different type of information than a self-report, specifically or especially in clients who are unwell or lack of insight. So in behavioral assessment, it provides us with different information, or the behavioral information, or the B data or behavioral data according to Thunder, and especially in clients who are unwell or lack insight. So they are those who are unable to articulate. Say for example, if we are dealing with schizophrenic patient. So they often come across a jumbled communication. So we get to rely more on the behavioral data or assessment. So next is the main goal. The goal of behavioral assessment is to pinpoint environmental conditions that are acting to trigger, maintain, or extinguish certain behavior, and to target specific behavioral patterns for modification through intervention. Say, for example, like um, to administer or to uh, through uh, giving interventions like classical conditioning for phobia and operant conditioning for behavior. And essentially, we conduct behavior assessment in order to describe, explain, predict, and correct behavior. So the last is the how behavioral assessment. So how is behavioral assessment being conducted or conducted? So the answer will be uh, it varies, of course, according to the purpose of the assessment. And another key how question relates to the analysis of data from the behavioral assessment. And now let's proceed to the varieties of behavioral assessment. So in this section, I will discuss the many varieties of behavioral assessment of which the behavioral assessment is conducted. So first is the behavioral observation and rating scale. So generally, behavioral observation observe behavioral observation involves watching the activities of targeted clients or research subject and typically maintaining some kind of record of those activities. So records may be in a form of transcribed recorded videos or behavioral checklist. And researchers, clinicians, or counselors may themselves serve as observer, or they may designate trained assistant or other people. This is what I am referring in in the earlier in my discussion, in which the clinicians or the psychologists themselves or the researchers themselves may do the observation, or they may appoint anyone who or designate anyone to observe. And it is very it is an advantage for us students or even graduates to experience a observing a behavioral observation assessment. And and in order for this behavioral assessment to be standardized, behavioral rating scale is made. So it is a pre-printed sheet on which the observer notes the presence or intensity of targeted behavior, usually by checking boxes or filling coded terms. So the next variety of behavioral assessment is the self-monitoring. So self-monitoring may be defined as the act of systematically observing and recording aspects of one's own behavior and or events related to the behavior. So self-monitoring is different from self-report. So uh, while self-monitoring provides useful information, self-monitoring can also be intervention in itself. Say for example, if the client given by the assessor is given by assessor to self-monitor through making a food diary. So through this, the client will be conscious of his or her diet and can personally manage the food intake and do some exercise. Next is the analog studies. So in analog studies is a research investigation in which one or more variables are similar or analog to the real variable that the investigator wishes to examine. So this definition is admittedly very broad, and the term analog analog study has been used in various ways. So behavioral approach to this kind of study is considered as the researcher's approach to examination. So it means that analog studies is considered as a researcher's approach to examinations, and it is done according to the plan and insight of the researchers to but actual but similar to the actual events. So analog behavioral assessment or observation or analog behavioral observation is the observation of a person in a contrived environment. Contrived, it could be a waiting room, a playroom, or a clinical setting, designed to increase the chance that the assessor can observe targeted behavior and interaction. So, one example of analog studies is the situational performance measures. It is a procedure that allows for observation and evaluation of an individual under a standard set of circumstances. So typically, it involves performance of some specific task under actual or stimulated conditions. So situational performance measure is another type of analog studies. So sample of this is the test drive or in a Taylor. So next is the leaderless group technique. So in leaderless group technique, several people are organized into a group for the purpose of carrying out a task as a task. So in leaderless group technique, it is a technique in which individuals are grouped without designating a leader, and in and the observer will take note who among the members initiate the conversation, stand as a leader, and who among them is not cooperating. And is commonly used in job scenario in which it can verify what you have written on your resume. Um, Next is the role play. Another um, example for analog studies is the role play. It is acting an improvised or partially improvised part in a simulated situation and can be used in teaching, therapy, and assessment. So role play can provide a relatively inexpensive and highly adaptable means of assessing various behavior potentials. So we cautiously say potentials because of uncertainty that role play behavior will then be elicited in naturalistic situations. So role play, for example, is that if we are dealing with clients with a social anxiety wherein they he or she is afraid of talking to their boss. So what we are going to do is for us to act as the boss and the our client to start to talk to us like the boss. So what the um, assessee will do is to the help the client to know how to get over with the anxiety. So next is the psychophysiological measures. So the problem of reactivity is a serious issue. So I will discuss more on the reactivity in the along the way. So since we cannot fake our bodily processes, say for example, if our client is truly stressed, but he or she denied that he is stressed, and it is not visible in his physical aspect that he or she is not stressful. So it is efficient to have some psychophysiological measures like the heart rate or the blood pressures because it is very important to be indicated in our behavioral. assessment data. So psychophysiological measures are measurement designed to gauge or measure biological processes such as heart rate, the blood pressure before, during, after the assessment, the EEG, and the temperature during the assessment. So these are in although the although in psychophysiological measures we tap the medical aspect, but it is still considered observable behaviors because it believes to be affected by um, psychological processes. And psychiatrists may measure blood pressure before, during, or after the session, as what I have said. So heart rate monitor may take continual measurement during an experiment. So there are types of psychophysiological measures. The first is the biofeedback, and the biofeedback is broadly as the class of psychophysiological assessment technique designed to measure, display, and record a continuous monitoring of selected biological processes such as the pulse and blood pressure. So biofeedback is measured during the assessment in order to uh, monitor the blood pressure or the pulse of the client, because from this monitoring or from this information derived is based on how the assessee will believe what the client is talking. Say for example, if the client starts to talk about severely traumatic experience, and however in his biofeedback his blood pressure is low, so definitely the assessee will have the reason to question the statement of the client. So biofeedback is used to measure it. Next is the plethysmograph. So generally, it is an instrument that records changes in the volume of a part of the body arising from variations in blood supply. So um, volume of a part of a body or many and different part of the body. So it could be in your arms, in your or whatever part of your body, and it has been used to examine normal anxiety-ridden and clinical population. So one type of plethysmograph is the penile plethysmograph, in which it measures changes in blood flow, but more specifically blood flow to the penis. So it is literally an instrument is uh, wrapped inside wrapped around the penis of a person, and then and if the blood changes, so it the measurement starts. So refer to the picture presented. So penile plethysmograph is illustrated like this. So uh, the instrument is placed in the penis of the man, and then uh, upon watching here in the TV, so the 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 changes in the blood will immediately be recorded. And volumetric data, so this is the record from a study conducted with a penile plethysmograph. So volumetric data is what is called to what is extracted in the study of penile plethysmograph. So the application of penile plethysmograph is also in forensic setting. So types of another type of psychophysiological measure is the polygraph, so commonly referred to as a lie detector. so best known measurement tool in popular culture. So despite perspective of crime show drama, so pretty, polygraph is widely used in the crime crime scene drama that we mostly have seen in TVs or any platform. So polygraphs are not admissible for evidence of innocence. So it is not admissible as evidence because it may trick an innocent person to just confess the crime and the guilty person to fake the emotion or the tension so that the instrument cannot measure the lie. So they are sometimes used by law enforcement to cast doubt on on a suspect recollection or applied psychological pressure. However, there is a high false positivity rate or for lying where more than 50% of the innocent subjects are labeled as guilty. So false positive if, for example, an innocent person is questioned and, for example, he or she tells a statement even though not related to the case, and he or she started to to get into trouble in his words. So the machine will automatically detect and eventually label that person that is supposed to be innocent as lying. So psychopaths are those with special training can often lie and beat a polygraph, so validity is dubious. So as what I have said, that polygraph can be lied, especially with those well-trained individuals. So they can really lie in during the polygraph, um, during the conduction of the polygraph. So now let's take a look with what really is in a polygraph. So do the question here is, do polygraphs really detect lies? So according to some supporters, they claim that 85 to 95% is the accuracy of polygraph, while those critics say that there is not enough scientific evidence to say whether it detects lies or not. So how polygraphs really work? So in this illustration, it presents three functions of a polygraph. So first is it measures blood pressure, in which a blood pressure cuff is placed on the arm of the person, and it records the pulse and the blood pressure. And the second is the it measures the heart rate or the breathing rate of a person, in which a rubber two rubber tubes is attached in the chest and the abdomen of the person. And the third is it also measures the sweating of the person, in which there are two metal plates attached on the two fingers of the person, and the sweating the sweating here is known as the galvanic skin response, or the GSR. So the galvanic skin response is what happens here is when a person sweats, what is released is not only water but also includes salts, and it, it also includes salts, and salty water conducts electricity. So as the person release GSR, or the galvanic skin response, so the machine sensor will automatically detect how much the person is sweating, and it depends on the assessment of the assessor, or the or the one who administered the polygraph on whether the person is lying, um, according to how much the sweating or any factor. So the advantages of psychophysiological method is that one advantage of this is the data here is difficult, perhaps even impossible without training to fake. So as what I have said, that psychophysiological method is can only be tampered through intensive training. So, and in this sense, it is said to be non-reactive. So the book calls this unobtrusive. Unobtrusive. So the while data gathered by behavioral observation and rating is useful, so as we admit or we acknowledge that the behavioral observation is really and rating is really useful, but it does have its problem. So it is what I am referring to earlier in my as I mentioned earlier in my discussion about the reactivity. So if you were being observed by a psychiatrist, or would behavioral assessment make you feel slightly uncomfortable or even paranoid, or might it make you harder to develop a positive therapeutic report? Or if you were in a mental health clinic, would you want to know what the psychiatric nurse are writing about you? So reactivity is when you are conscious of being observed and assessed. So people often change their behavior simply because they are being studied. So the term here is the Hawthorne effect. So the Hawthorne effect is the changing of a person's behavior because of the consciousness, or because of the fact that they are being studied. So here is the issues in behavioral assessment. So the psychometric soundness of tools of behavioral assessment can be evaluated, but how best to do that is debatable. So questions arise about the appropriateness of various models of measurement. So in this point, that the the behavioral assessment's reliability and validity is already evaluated. However, there is a debatable sense here in the how to do the behavioral assessment best, or the uh, or the how best is behavioral assessment can be performed, and there must be an acceptable level of inter-rater validity among observers or raters. So since the behavior observations mo- behavior observations rely on the the researchers assessment. So in order to have unifying assessment to a client, so the researchers or the observers in the assessment should have inter-rater reliability among themselves, and if not, it will cause a construct effect in which a potential source of error in behavioral ratings, when a dissimilarity in two or more of the observed behaviors leads to a more favorable or unfavorable rating than than would have been made had the dissimilarity not existed. So another issue in behavioral assessment is the reactivity. So in which the person become conscious that he or she is being observed, and that they may change their behavior during the assessment. Next is to combat potential contrast effects and other types of rating error. Rigorous training of raters is necessary. So, however, such training may be costly in terms of time and labor. So, issue here in behavioral assessment is the monetary issues, because not only in training, but because it is behavior assessment, it is necessary to conduct a video recording. So a video recording cannot only be placed in one place. There should be several cameras recording the situation. So it make it um, profit uh, not profitably, not profitable. So some types of observer bias cannot practically or readily be remedied. So the bias here in behavior assessment is cannot be remedied. So as what I have said, the economic practicality of the situation is that it is seldom feasible. It is seldom feasible. So that is about the issues in behavioral assessment. So now for the final topic of chapter 12 is the recall of personality disorders. So DSM-5 or Diagnostic Statistical Manual 5 is the Bible of mental illness. It contains a number of mental health conditions, for example, the depression, PTSD, OCD, and, and many more, in which we have learned about in our abnormal psychology subject. So, as I recall, specifies a range of symptoms, but but not all of which are required for diagnosis. So, for example, in depression, it has 8 symptoms, but only 5 of which is needed to meet uh, the diagnosis. So, specifically, personality disorder, the class of mental disorders characterized by enduring maladaptive patterns of behavior, cognition, and affect. So up until now, we've treated personality as either a trait or a temporary state. And personality disorders are clusters of maladaptive traits. So moving forward, so the DSM-5 outlines 10 different personality disorders, and some of which overlap considerably by making diagnostic difficult. So as what I have mentioned, that personality disorder is a cluster of maladaptive traits. So personality disorder has have 3 clusters. So cluster A, or the odd or eccentric personality disorders, which is the paranoid, the schizoid, and the schizotypal personality disorder. For the cluster B is the dramatic or the erratic, the in which there is the antisocial personality disorder, which is characterized by aggression, criminality, or lack of empathy. Next is the borderline personality disorder, which is characterized by abrupt mood swings, love you or hate you situation, and self harm. So borderline personality disorder is commonly in women. So histrionic personality disorder, it is characterized by attention seeking or and abrupt mood swings. And the last for cluster B is the narcissistic personality disorder, in which there's a need for admiration, lack of empathy, or all about me. So in dealing with narcissistic personality disorder, it is very difficult for the researchers to, or the clinicians to deal with narcissistic personality of the client with narcissistic personality. And the last cluster is a cluster C, which is the anxious or fearful. The first is the avoidant personality disorder, which is characterized by social inhibition, inadequacy, sensitive to negative evaluation, and depend The second is a dependent personality disorder, which is psychological dependent on others, need for care. The last personality disorder in the cluster C is the obsessive compulsive disorder, or the OCPD. Here, it is characterized by conformity rules, perfectionism, and not actual OCD. So, in reference, so we use the psychological testing and assessment, an introduction to test and measurement by Cohen and Swerdlick, 2018. And this ends my report for chapter 12. And once again, I am Keith Benedict Fernandez reporting.
And I am Edwin Jay Bolando reporting. And this
And
is
this is chapter
per
12, the
personality
personality
assessment
assessment
methods.
methods.
Thank you.
Thank you.